Healthcare in Your Hands. This is Julia. So Julia has graduated from Thomas Jefferson University with her BSN, and she's been working as an emergency room nurse.
ICU.
ICU, okay.
Yeah.
All right, so why don't you tell me a little bit about that?
So I work at Huntley-Jones University Hospital. It's in Philadelphia. I worked there for a little over 3 years. I work in the ICU where we get a lot of like neurological and medical patients. So people coming in with strokes, aneurysms, pretty much chronic diseases that have gotten really bad, like diabetes, like end stage kidney disease, liver failure, all that. People that are like either really sick or dying usually.
Yeah.
So, but yeah, that's what I do. I don't really have any background in holistic stuff, but I am very interested in it.
Okay. Yeah, no, that's fine. I mean, I like being able to get kind of different points of view. I talk to a lot of holistic practitioners.
Yeah.
So it's nice to be able to hear from someone who's not like, sound healing, vibrations. Like, I love it, but I'm like... So what do you think of the current healthcare system in our country today?
I mean, I don't think it's bad. I definitely think it's really amazing. Some of the things that they can do is awesome. People come in with strokes that normally, if you don't have any intervention done, you would probably die.
Right.
But you come in and they do these treatments and medicines and you're sometimes healed.
Yeah.
The one thing I will say is I would like to see more holistic things, I guess, incorporated in the medicine, because it is very, I guess, medicine focused, like not really whole body, whole mind. Some things are, like with a lot of end of life care, they do bring in like hospice, and a lot of times they're incorporating that. But even with that, I would like to see a lot more, holistic things incorporated in. But yeah.
Do you see any holistic in the hospital at all? Is that like, I mean, other than the end of life care, is that something that's even brought up?
Not really, no.
Nah.
Not at all. Like, it's not like the thing is about it is a lot of people come in with medical problems that need to be fixed, but sometimes the root cause is more of not a mental problem, but a lot of times people do have mental issues as well, and it draws into their medical problems. Like, for example, people are alcoholics. They drink so much that they go into liver failure.
Right.
But sometimes some people it's easiest saying like, oh, stop drinking, you won't go into liver failure. But other people it's more like they're depressed and they need something else.
Yeah.
And like we just kind of are like, yeah, stop drinking and you'll be healed.
Yeah.
And some people can't do that, so.
And that's that whole debate with like people just not even seeing addiction as being a disease. They're like, oh, it's just your fault, you just need to stop. And I'm like,
I mean, they are really good at like understanding that, but it's just kind of like that line where we were actually helping them to get better, whereas just giving them like, oh, here's some rehabs that you can go to and you'll get treatment. You know what I mean?
Right.
Whereas, I don't know, I feel like there should be other options besides that, because that doesn't work for everyone.
Yeah. I mean, there's a lot of people a lot of addicts who, there's underlying issues where it's normally mental health issues that have kind of led them into their addiction.
Yeah,
so
exactly.
Being able to have, I guess, like, more options.
Yeah, no, and I mean, I think there are a lot of options out there, but I feel like it's just, when we send people out of the hospital, we're fixing their problems, but we need to give them something to help them to prevent it. You know what I mean? Like, I don't know the word I'm looking for is, but.
I mean, preventative medicine is typically what I think of when I think of like holistic practices. Like, I don't use that for like, if I had a broken leg, I'm not gonna like go see that way contraction and be like, here, heal me.
Yeah, exactly.
But I mean, like, even with me, like, I use all the essential oils and everything, but that's mainly just preventative health for me. I do it as like a daily supplement kind of thing. I mean, I use them when we get sick, but that's because I'm crazy enough to do that kind of stuff.
Well, no, I think like the On Guard really does help, and my mom's into like, she gives me liquid silver when I'm sick. I really don't know anything about it, but I've taken it a couple times, and it really does help me get better when I'm sick.
Yeah, I don't even know.
I don't know what it is either, but
I know it's called frankincense, liquid gold, but
but the On Guard too. Like, I'll take a couple of those little tablets things when I'm feeling sick, and I haven't really gotten sick in a very long time.
Yeah. Has she ever done the flume with you? Flume is supposed. It's frankincense, lemon, on guard, oregano, and melaleuca.
Oh, that sounds like a nice combo.
It burns.
Really? Do you put it on like you eat it?
You can.
What do you?
So there's
put it on your skin.
Yeah, so you can put it in a roller bottle and put it on your skin. That's a really good preventative one. If you're actually already sick, I don't typically like using the roller bottles. I like taking it internally, so I'm getting the full effect. So I'll do either in a veggie cap. You can get like the little empty veggie caps and put them in yourself. Or if you're daring and you don't mind possibly burning your throat, you can do it in a spoon with like some honey.
Nice.
The honey will help, but
it still burns a little.
yeah, oregano is definitely a strong one.
Yeah.
I tried that one by itself the first time. I was like, I've had spicy boils. I'll be fine. I puked. Right off the bat. It's not happening ever again.
Yeah. Wow.
So what are some misconceptions I guess people would have of either holistic practices in, I guess, in your work?
I mean, like I said, there's really no holistic practices. At least
right.
where like I work. I would hope that on some like oncologic floors and things like that, they would have a little more. And I mean, I have seen it not in my work, but in like hospital settings. Like for example, I had a minor surgery and I was under anesthesia, so when I woke up, I was nauseous.
Yeah.
And at the hospital, they gave me like a stick with like they smell, and it had like essential oils on it, and
nice.
to like relieve the nausea, and it helped because
Yeah.
I've taken those things at home, and they always help. So that was cool, but. Yeah, I mean, I don't really know any misconceptions just because there's no, at least in my experience, not really a lot of holistic in hospital settings at all.
Yeah, I was talking to, I think they're like just starting really right now.
Yeah.
Like, there's like one in Texas and like maybe 2 other hospitals in the country
Yeah.
that have like really started to try to implement it.
Yeah.
But yeah,
It's kind of crazy, but yeah, like I hope that it will be incorporated throughout my lifetime into like hospitals and just medical settings in general. But yeah, as of right now, there's not really a lot.
Okay. Do you see it as like a realistic, like a spot for it? I guess.
Yeah, definitely, because we have so many, I guess, people that we can like consult in the hospital, and I can totally see like a holistic, expert being someone that we would consult for things because it can help with numerous problems, mental health, emotional problems, and physical problems too.
Yeah.
So I think it would be really great if it could be incorporated into it, but hopefully we'll see that in our lifetime.
Yeah. That would be nice.
Yeah, it would be awesome.
How far do you think they'd be willing to go? Because I know, like, you've talked about the essential oils, but there's, like, there's the acupuncture, there's chiropractic, but then there's also, like, the sound healing and the, like, the Reiki and things that just get a little bit more ethereal. Do you see, like, spots for that as well, or?
I definitely see spots for that in, like, outpatient settings more so than inpatient. I mean, there's definitely some room for inpatient things, too, but I feel like the hospital's kind of goal is like get you in, fix you up, get you out as soon as possible. Because I mean, it does cost a lot of money to keep someone in the hospital. You know what I mean? So like, I mean, I think it would be great to give people, at least information and info on people or practices that they could go to outside of. But as far as inpatient, I think they could at least have like a practitioner that like guides them in that direction, gives them information, starts like a treatment process. But I couldn't really see too much like all of those things in a hospital. And I'm not saying that's not possible, but I think outpatient would be a better fit for it.
Okay. That's cool then.
Yeah.
Do you see it, because I know you've been talking about it as like someone coming in, having an expert coming in. Do you see that as something that like doctors or regular healthcare professionals would get some kind of training in, or do you think it would be more of like just kind of consults?
I think it could be either. I think it could be either healthcare professionals get trained in it and they're teaching people about it, or if we had like a hospital expert or a couple of them or a team, and then they could be consulted and they could come talk to patients throughout the day, every day.
Yeah.
Because we have a lot of teams that do that kind of stuff. So.
Okay. They're kind of already moving in that direction.
Yeah. They just would need to implement someone.
Yeah.
But there is like hospital budgets are always tight, so it would definitely be an issue, like not an issue, but a challenge to bring someone in that would cost more money and stuff.
Right. And that's always the thing.
Yeah.
The money.
Yeah. We don't want to spend more money. We want to spend less money. It's always the thing. But.
Okay. So what are some of like the biggest problems that you do see in our healthcare system today? We get to see see it like firsthand.
Yeah. Again, since I deal with a lot of people that are like sick and dying, a lot of times doctors and medical practitioners want to do everything possible to like make these people better.
Yeah.
Where you know, there really should be a line drawn and been like, hey, like maybe we should take a step back, and since we can't really, there's not really any good hope that we can get these people better, like focus more on like comfort. And I mean, they do, again, they have hospice, they have palliative care, which are great and everything, but I think if they incorporated more, like, I don't know the word that I'm trying to think of, but like, again, I think a holistic approach with that would be very, very helpful and beneficial to patients and their family members too.
Yeah.
Because when people are dying, you know, it's not just the person that's dying who's going through that; it's their families. And I mean, they also have like bereavement teams and everyone that will help them. But you know, sometimes people need like counseling, or you know, they're depressed after a loved one dies, so that can stem issues there. So I think that is an area where holistic medicine could really have a big impact.
Yeah. I mean, I have a friend, she just had a child, so she was talking about like being able to find places in the area that do a lot more holistic things, but for pregnancy. And I was like, why do they only have that pregnancy? Like, I hear about midwives and doulas and all that, and I'm like, where is that everywhere else in this community?
Seriously though, like every stage of life you could use it, and it would be beneficial.
Yeah.
But yeah.
So I have to ask, working in a hospital, is it really like the full moon? Does that really?
Yes. Yes, that is totally a thing. I can't give you an explanation as to why, but I always I'll go in sometimes and it'll be a full moon and I'll be working night shift. Crap. Like, cause it never fails. It's a crazy night. Like every time. It really is. Or like we'll joke, like if it is a crazy night, we'll be like, is it a full moon tonight? Because it feels like it. It's a thing. Yeah.
Now I used to feel it as a bartender, but I'm like, that's bartender. You know, you get crazy people all the time.
Yeah. I mean, we do too, but it definitely is a thing in the hospital too. Yeah. Crazy.
All right. So, you know, we've talked a little bit about like homeopathy. We've talked a little bit about holistic. Do you see this starting maybe in the hospitals first, or maybe first as like a private practice kind of thing, or like small, like independent?
I definitely see it as a private practicing first, but like I said, I think if when like in the hospital setting we were trained or had people that were able to come in to give information and that doctors knew to you know give people consults for that when they were discharged, I think that would be a really big thing.
Okay.
Because it's like there could be all these practices, but like people don't know about it,
right? Or
they're not told about it, because it's a newer thing, so people I feel like are a little hesitant to go into that because they're like, oh, holistic, that doesn't work. Like, you know what I mean? Some people do say that.
Yeah,
it's crazy.
No, absolutely. But, and do you think that, like, because you're talking a lot about like with the older people, is that something that you think that the generation right now that is at that age group that they're going to accept it?
I think our generation definitely will. Like the younger generation. I mean, the older generation too. Like my mom. Like she's all about. She's kind of the person who like got me into it a little bit. But yeah, I think both. But I hope that with our generation we'll kind of incorporate it more, since we're kind of like, just starting to start our careers. Not just starting, but like.
Yeah, no, but I agree. Like our generation, I think will definitely jump on board. Yeah. I know when I first started, I was teaching yoga at a senior living facility, and it's like we couldn't call it yoga. We had to call it stretching, and like they wouldn't call it yoga. Like they just didn't want to go. They believed that like we were gonna like pray to Buddha or something. I don't think you pray to Buddha like that.
I feel like I've never been to a yoga class that we prayed to.
No,
like that's not even like I mean it. Yeah,
but that was like the conception that they had was like. This is, I'm going to have to change religions or something, so we would just call it stretching. And I couldn't, like, bring in my essential oils, like, they were like, oh. And they ended up being, like, some of the most loyal people I ever met. They, like, came to every yoga class. I think it took us, like, a year to get into, like, calling it yoga.
Yeah.
And they all wanted to, like, try the oils. I felt, it really did feel like we were, like, all praying, because I would, like, go around and I'm like, I just, like, a drop of oil in everyone's hand. It's
yeah.
I was like, okay, good. But it took a while to warm the idea up to them that, like, yeah, this is gonna help you feel relaxed. We did lavender. We would do like stuff for your skin and everything. It took a while to like really kind of, I guess like ease them into the idea that I wasn't gonna like voodoo them.
Yeah, no, I think a lot of people, there's a lot of misconceptions about holistic practices.
Oh yeah, for sure.
But that's crazy. I can't believe that one.
I mean, it honestly, like in the end, they were fine with it. But like I said, it takes a while to warm up to it, and that's why I'm like, is this something that we're gonna really be able to see? Just because there's so many people that we need to convince that like this is an actual alternative.
Yeah.
It's not this crazy, I'm gonna scream in your face and somehow you're gonna feel better. It's not like a crazy like I'm gonna play on a bowl and everything's gonna go better. Like but it actually works as long as you allow it to.
Yeah.
If you build up these walls and you're like, this isn't gonna work. I don't even want to accept it, it's not gonna work.
Yeah. Yeah.
But I don't know, that's where I'm at. I'm like, I don't know how like understanding people are gonna be with it.
Yeah, I like I said, I feel like people, at least all the people that I'm around, seem pretty understanding about it, and at least open to trying it. You know, and for most people that I know that have tried things like essential oils, and yoga and acupuncture, and Dom's sister does Reiki, like it really helps. And like it's like you have to go into it thinking that you can't just be like, oh, this isn't going to work. Because obviously, it's not going to. But and with my experience as well, all of those things have helped me in emotional ways, physical ways, everything.
Yeah. It's funny because of Reiki, the first time I heard of it was someone had gotten into a car accident and really had like busted up their leg, and their leg was spitting outside their car, their legs all, and someone came up to them and was like, here, I'm going to do Reiki. And immediately I was like, Reiki people are crazy. Like, I can't. We're done with this. But, so I had torn my ACL and meniscus a while back, and it was like 3 years later, I could still kind of feel it. I mean, those kinds of injuries kind of last forever with you.
Yeah.
So, and I had a friend who had been trained in Reiki, and she was like, here, let me just do this. And at first I'm like, oh my gosh, this crazy lady, like, don't touch me, I don't want this.
Yeah.
And honestly, like, after doing it 3 times, we were just in a weekly class together. After about 3 sessions. Normally it's Oliver's.
Oh, dude.
But Oliver will jump up on the table, like, put his paws up and be like, hey guys, how you doing?
See, that's cute. The barking is just like, oh, just shut up.
It's just because he can't see you.
No, it's just because he's afraid of tile floors.
We gotta get him the little
I have them. I should have brought them. I forgot your house is all tile. But I thought that he would, I feel like he should be overcoming these fears, but.
Even in your house, I mean, you guys have, is it just the kitchen that's tile? Or?
Just the kitchen's tile, but the hardwood floors are in the majority of the rooms, and he's okay with that, and it's just hardwood, so. I mean, he doesn't love it, but he will walk on that over tile.
Oh, okay. But yeah, it just looks like hardwood. It's tile.
Is it really?
Yeah. I didn't believe it.
How?
Upstairs is actual hardwood, but this is...
Well, this looks real, so.
Yeah.
Fooled me.
But yeah, so with the Reiki, we were like taking a weekly class, and I guess like after three or four times that she had done it, I was like, holy crap, like my knee actually feels better.
Yeah.
But it took for me to be like the same thing. I had to actually experience it. Like, they're not crazy.
Yeah. No, it's true. Yeah, I've only had Reiki a couple times, but Dom's sister does it. She's really good. And like, I'll just say, the first time I had it, I was like, I had no expectations. I was just like, all right, I'll try it. And it's just a weird feeling. It's like, it feels like so much energy where they're touching you, and it's like, how is this like this like strong, like just from them touching you? But I will say, like, I felt like calmer after, and like I have back pain. I don't really know what it's from. Maybe from my job, maybe from my bad posture. I don't know. But I felt like my back felt better after. Yeah. It was great.
Yeah, it's like, I feel like just like heat. At first I was like, oh,
But it feels like stronger than just someone just touching you. It's
like you feel it like under your skin.
Yeah, it's interesting.
It's pretty cool, because it is definitely one of those like more ethereal ones that people are like,
Yeah. I mean, I'll say that was kind of, I was kind of like, oh, Reiki. Like, but you have to try it. It's interesting.
Yeah, the idea of like, don't knock it till you try it is like, it's for real. Because like, you go into this and like, I feel like I'm a pretty open-minded person. Yeah. And I was like, guys are all crazy.
Yeah.
It's like, let me put my wheels on to protect me from your energy. He's nice. Yeah, dog problem. Have you ever tried the essential oils before? I remember you were saying something about it.
No, I never even actually thought about that. Do you just like put it on your skin?
It depends what kind you use. No, Oliver, he can't stand it if it's on his skin. Especially with the lavender, like he actually acts like he's like caffeinated if you put lavender on him.
That's hilarious.
But I mean, he loves chamomile. So
I should try that.
Yeah.
Do you think that would help with his?
It helps with
I don't know if it's like anxiety. Yeah, it's the weirdest thing, but I don't know if it's anxiety about tile floors. Like, he's just weird.
Well, they all have their quirks, honestly.
Yeah.
I complain about Oliver really religiously, but it's like he's not all that bad.
He's great, man. Like, I love him. Like, he's awesome. It's just like tile floors. That's the one thing.
Have the socks helped?
Yeah, but that like he walks like any typical dog would in socks. It's so funny, and I don't think he enjoys wearing them, but it's just hard to keep them on. Like, I can't keep them on him all the time, and I don't like to have them on outside because then they get all muddy and stuff.
Yeah,
but yeah, they do work. Like, he walks around the house with the socks on and doesn't slip and doesn't have anxiety about going in rooms. So it's good.
Yeah, if you try diffusing, Oliver will do it if it's like diffused, and I think it's maybe because it's just like a lighter smell.
Yeah.
He like does not like the smell of lavender. He does that thing where he like smashes his head into the floor and like tries to rub the smell off. I'm like, it's not gonna work, dude. Like, I put it under your fur.
It's there. You're not getting rid of it.
So we just stopped putting it directly on him. I just diffuse now.
I'll have to try that. Maybe I'll try that today. See if he starts walking on the floors there.
Try it out.
Yeah. Worth a try. Don't knock it till you try it.
There we go. All right. Well, thanks for coming by.
Yeah. I hope I had some good info.
Yeah.
And I learned a lot too.
So I always tell everyone you got 30 seconds to a minute. If you want to plug something in that you've got going on, let people know what you're doing. I don't know if you have anything fun or interesting that you want people to know about.
It's not really fun, but I actually just started listening to podcasts. I've never like really listened to them anymore, and it's pretty cool. Like, on the drive here, there's an hour and a half ride, so I was like, instead of listening to music, I'm listening to some podcasts and learn some stuff. So I did, and it was cool. I learned about I can't remember. It's like ETC. It was like emotional. Oh my god, this is making me mad. I can't remember it. But it was like therapy, like tapping therapy. Sounds so weird, but to like heal emotional problems and everything. It was cool. Now it's hold on, I gotta look it up now that I can't remember what it was.
No problem.
Emotional treatment? No. Okay, I don't know if Sarah's here.
I don't know. Here, you can use my phone if you'd like.
Right.
I have a friend who does the tapping. She does it like on her face though.
Yeah, it was interesting. It was like there's therapists who do it, but you can also, look up videos and teach it to yourself. But I thought it was interesting.
It's actually one of the trainings that I want to do. There's like an aroma touch technique where it's like you use, I guess, tapping along with essential oils. EFT. Okay, yeah.
EFT.
I should have known that.
I literally listened to this on the way here and I couldn't remember. Emotional freedom technique is what it's called. But yeah, it was interesting. When they first mentioned it, I'm like, oh, this is gonna be like a drag. Like, this isn't gonna work. And I mean, it sounded pretty interesting and it sounded like it helped a lot of people. So it was cool.
Nice.
Yeah. Podcasts.
What's your favorite one?
I mean, I don't really listen. Like, I'm not like subscribed to any really. I kind of just like, I'm like, I want to learn about this today. Okay. And I'll just like look up a podcast and look up one that's good and I'll listen to it. So yeah. Today I looked up the holistic stuff. So I was like, I'm in the in the holistic field today. So
very nice.
Yeah.
You should try. Obviously, I'm listening to like all comedians stuff.
Yeah, that's
Bill
good.
Burr, Joe Rogan, and Tom Segura.
I've heard Joe Rogan has a really good podcast.
He does.
Yeah.
That was like, I think, my first podcast that like I really got into. But Tom Segura's is really funny. It's him and his mom, him and his wife.
Wait, doesn't he have a thing with his mom or his dad? I feel like I've watched something with Tom Segura, and
it's called Your Mom's Basement.
Okay, so maybe that's what it was.
But him and his wife, and they're hilarious.
Yeah. Maybe I'll listen to that on the way home. I'll do comedy on the way home.
Fun stuff.
Yeah.
All right. Well, thanks again.
Yeah, thank you for having me.
No problem.